Book 1, Unit 1, The Role of a Paramedic, Exercise 5, page 5.
Press release. Spencer County Health is expanding the Department of Paramedicine. This will include a larger team of first responders. We believe this is an essential improvement for our county. Our goal is to raise our level of pre-hospital care. Currently, our EMS and hospitals have poorly coordinated procedures, and that's not good for patients. Of course, our ambulance operators transport patients to the hospital. However, many do not have the training to give expert treatment. Better education will improve the quality of healthcare throughout the county. Additionally, it will reduce the strain on local ERs. The expansion program will begin later this month.
Unit 2, Parts of the Body 1, Exercise 5, page 7.
The Flagton Gazette, 27th May. Major collapse at construction site. On Wednesday, a structure collapsed at the 10th Street building project. 2 people were inside. 1 worker was on the ground floor during the collapse. Falling debris caused abrasions to his head and shoulders. Paramedics treated lacerations to his face and neck. Also, a heavy object fell on his arm. This strained his elbow and broke his wrist. However, his hand and fingers were unharmed. The other worker was on the 2nd floor. The fall mostly affected her torso. Paramedics treated a severe trauma to her back and chest. Then, they transported her to the hospital for a punctured abdomen. So far, the cause of the collapse is unknown.
Unit 3, Parts of the Body 2, Exercise 5, page 9.
Spencer County Health, Patient Care Report. Patient, Nelson Fiona. Incident number 03-19701. Chief complaint. The patient complained of pain in both legs. On the right, it extended from the groin to the knee. On the left, it affected the calf and ankle. History. The patient was in a vehicle collision. Assessment. We arrived to find the patient in her vehicle. Clearly, there was an impact just below her right hip and buttocks. Vehicle damage on the other side trapped her left foot. We freed the patient's foot easily. There was minor bruising around the toes. There was also significant bruising along the shin. However, no fracture was evident there. RX. The primary concern was the patient's right thigh. I suspected a fracture of the femur, so I splinted it. Transport. We transported the patient to Spencer City Hospital.
Unit 4, The Musculoskeletal System, Exercise 5, page 11.
Introduction to Anatomy. Overview. The musculoskeletal system. Function. The musculoskeletal system forms the basic structure of the body. Parts. One major component of the musculoskeletal system is the skeleton. Bones and cartilage maintain the body's shape. Some bones also provide protection for internal organs. For example, the cranium protects the brain. The spine protects the spinal cord. The muscles are another major component. They allow us to control our movements. Sheets of tissue called fascia hold the muscles in place. Other musculoskeletal features are connective tissues. A ligament connects 2 bones at a joint. A tendon also attaches to a bone. However, it connects the bone to a muscle instead.
Unit 5, Integumentary System, Exercise 5, page 13.
Guide to the integumentary system. Your skin is a complex organ. On the surface, this thin layer is the epidermis, figure 1. It is the part that we can normally see. We also see the hair and nails that grow through it. Just below the surface. The dermis is the thicker layer below the epidermis, Figure 2. Here, follicles produce the hair that grows to the surface, Figure 3. Various bodily processes occur at this level. For example, glands, Figure 4, produce sweat and skin oils. Also, nerves communicate messages from here to the brain, Figure 5. Farther below the surface, below the skin is subcutaneous tissue, Figure 6. It contains veins, arteries, and fatty tissue. For more information, see the guide to subcutaneous layers.
Unit 6, the respiratory system. Exercise 5, page 15.
Peterson's Guide to Paramedicine. Medical emergencies. Respiratory conditions. Obstructions in the respiratory tract can quickly cause cardiac arrest and death. That's why rapid treatment for respiratory failure is so important. Problem: the patient cannot breathe. Check for obstructions in the upper airway. Ensure that the tongue is not blocking the pharynx. Also, foreign objects sometimes enter through the oropharynx or nasopharynx. Removal of the object will clear the respiratory passage. Spasms of the larynx are another possible cause of respiratory failure. Treatment depends on the severity of the condition. See Treatments, Laryngospasms for more information. In other cases, the problem is farther down, in the lower airway. Obstructions of the trachea or bronchi may require emergency surgery. See Treatments, Lower Airway for more information.
Unit 7, the circulatory system. Exercise 5, page 17. Lombardo College, Professional Development, EMS, course number 47927. Cardiopulmonary Health. This course is for EMS professionals. It will improve their understanding of the circulatory system. First, we will review the cardiovascular system. Many common EMS calls concern the heart and lungs. Often, these conditions are life-threatening. The body relies on the blood vessels to distribute blood throughout the body. So capillaries must deliver nutrients to various tissues. So arteries and veins must constantly carry blood to the right places. If they cannot, the consequences are serious. That's why EMS professionals need a strong understanding of this vital bodily system. Later, we will cover the lymphatic system. We'll address the role of lymph nodes in immune system health. Unit 8, Blood. Exercise 5, page 19.
Flagton Community Blood Bank. Donations. Every day, our hospitals and EMS teams handle serious emergencies. Many require blood transfusions. Failure to replenish lost blood can quickly lead to death. That's why blood donors are so important. We accept blood from donors with any blood type. However, some types are more useful than others. For instance, everyone's bodies are compatible with type O negative. That means it is usable in nearly any transfusion. It especially helps recipients with rare blood types. These include type B negative and type AB negative. We also like to receive type O positive. That's because it is the most common type. Type A positive is also fairly common. Want to donate? Click here to make an appointment.
Unit 9, the gastrointestinal system. Exercise 5, page 21.
Guide to the gastrointestinal system. Digestion begins as soon as you take a bite of food. Figure 1. After you swallow, the esophagus carries the food to your stomach. Figure 2. There, powerful acids begin to break down the food. Next, the food travels through the small and large intestines. Figure 3. These extract nutrients. Hormones from the pancreas help you break down these nutrients. The appendix might also aid intestinal health. However, scientists disagree about its exact purpose. Other organs filter out harmful substances. These include the spleen and liver. Figure 4. Eventually, only waste remains. The kidneys remove toxin from your blood. Figure 5. This reaches your bladder as urine. Solid waste reaches the colon. Figure 6. There, your body extracts the last useful elements. Then, it expels the rest through the anus.
Unit 10. Vital Signs. Exercise 5, page 23. Peterson's Guide to Paramedicine. Procedures. Vital signs. When you check vital signs, remember the ABCs. They are airway, breathing, and circulation. Of course, the patient's symptoms determine how you proceed. But here are some basic steps for examining unconscious patients. Measure the patient's pulse in BPM. Does the patient have a pulse? Yes. Proceed to the next section. No. Follow steps for CPR, cardiopulmonary resuscitation. Measure the patient's rate of respiration. Does the patient breathe normally? Yes. Proceed to the next section. No. Check for obstructions in the airway. If necessary, perform intubation or cricothyrotomy. Measure the patient's blood pressure. Is it above 180/110? Yes. Follow steps for treating a hypertensive emergency. No. Proceed to the next section. Measure the patient's temperature. Is it too high or too low? Too high, treat the patient for fever. Too low, treat the patient for hypothermia. Unit 11. Measurements. Exercise 5, page 25.
Common measurements. Conversion chart. Measurements of length. 1 centimeter equals 0.39 inches. 1 meter equals 3.28 feet. Measurements of weight. 1 kilogram equals 2.20 pounds. Measurements of volume. 1 cubic centimeter equals 0.07 tablespoons or 0.20 teaspoons. 1 liter equals 2.11 pints. 1 drop equals variable. It is a very small quantity. To convert measurements on the left to measurements on the right, just multiply. For example, convert 12 centimeters to inches. 12 times 0.39 equals 4.68 inches. To convert measurements on the right to measurements on the left, just divide. For example, convert 5 pounds to kilograms. 5 divided by 2.2 equals 2.27 kilograms. Measurements of temperature. Degrees Fahrenheit equals degrees Celsius times 9/5 plus 32. Degrees Celsius equals degrees Fahrenheit minus 32 times 5/9.
Unit 12. Describing change. Exercise 5, page 27.
Spencer County Health, Patient Care Report. Patient, Smith, Herman. Incident number, 03-19845. Chief complaint. The patient was unconscious and suffering from hypothermia. History. The patient was lying in the snow. We do not know how he got there. Assessment. In the snow, the patient's body temperature plummeted. Circulation in his extremities decreased to critical levels. The declines in heart rate and respiratory rate were very serious. RX. We tried to increase his temperature by removing his wet clothing. His temperature fluctuated at first, then it began to climb slowly. Also, his chest started to expand more vigorously. Pulse and respiration rates spiked a few times. Eventually, we saw a steady rise. Transport. After the patient stabilized, we transported him to the Spencer City ER.
Unit 13, Tools and Equipment 1. Exercise 5, page 29.
From Gina Caldwell, EMS Supervisor. To Leon Gonzalez, Hospital Supply Coordinator. Subject: New equipment. Hi, Leon. My department needs some new equipment. Most importantly, some of our cardiac monitors are old. We need monitors with the latest technology to record ECGs. Also, 2 of our defibrillators are not functioning correctly. This is unacceptable. A patient could die as a result. I'd also like more stethoscopes, thermometers, and blood pressure cuffs. Our paramedics use these basic items many times a day, so I want to put some extras in each ambulance. Additionally, we need to increase our monthly supply order. The EMS team responds to emergencies in a wider area now, so we're using more intubation tubes and IVs than before. Let's ensure our paramedics have plenty of those. More IV fluids and oxygen tank replacements would be helpful too. Thanks, Gina.
Unit 14, Tools and Equipment 2. Exercise 5, page 31.
Attention, EMS managers. Do you need affordable, high-quality equipment? Call TCO Medical Supply. We carry a full range of supplies for wound dressings. You'll find bandages and tape in a variety of sizes. Plus, our gloves and masks reliably protect paramedics from exposure to infectious agents. Also, check out our line of precision tools. We carry scissors, needles, and many other instruments. Do you handle musculoskeletal injuries? Immobilize the area with the right splint or cervical collar. All ambulances and ERs need reliable equipment for moving injured patients. That's why we also have a wide selection of wheelchairs and gurneys. And don't forget stiff boards for those tricky spinal injuries.
Unit 15, Common EMS Calls. Exercise 5, page 33.
Flagton Emergency Services Department. Dispatch log. 10:19, 1:16 a.m. 74 Wolford Street. Auto accident. EMS responded to a 3-vehicle crash. All 3 drivers sustained injuries. However, none of the injuries were life-threatening. EMS did not transport any patients to the hospital. 10:19, 3:10 a.m. Eastern Park. Assault. An unknown assailant attacked a young woman. She sustained serious trauma to her face and neck. Paramedics immediately transported her to the hospital. 10:19, 8:15 a.m. Flagton Elementary School. Pediatric emergency. School officials believed a student was having an allergic reaction. However, it was a false alarm. When EMS arrived, the boy showed no signs of illness. 10:19, 12:58 p.m. 978 10th Avenue. Cardiac emergency. A geriatric patient showed signs of heart failure. Paramedics stabilized him and monitored his condition. He was stable when they reached the hospital.
Book 2, Unit 1, Parts of an Ambulance. Exercise 5, page 5.
Maintenance report. South Cranston EMS. Model number KL8947 ambulance. Mechanic Jessica Carlson. Service day Saturday. Part exterior maintenance. I turned the rotating lights on and off. I also tested the brightness of the strobe light. Then I checked the sound of the air horn and siren. All warning devices are fully operational. The red reflectors, however, were cracked. I replaced those. The yellow reflectors were still in good shape. The identification decals are worn and difficult to read, so I placed an order for some new decals. Cabin. I inspected and tested all equipment. The radio works properly, but the sound quality was poor. I repaired the cord to improve the sound. The previous technician already replaced and updated the GPS. Main interior. I checked the status and location of supplies and equipment. Everything was present, but some items were in the wrong places. I found a gurney unsecured. Lastly, I placed the extra stretcher into storage.
Unit 2, Ambulance Operations. Exercise 5, page 7.
Two, Alice Harriman, student. From, Glenn Preston, trainer. Subject, your driving performance. Hi, Alice. Overall, you are progressing satisfactorily in the driver training course. For one, you always make secondary stops at intersections. Also, you regularly observe the 2-second rule. Occasionally, though, you forget to check for crossing traffic. It's true that you have the right of way, but you still must be cautious in intersections. I am pleased to observe your appropriate use of warning devices. Also, you consistently find reasonable places to park. However, I must remind you to use the parking brake. Emergencies can be distracting, and sometimes the brake is easy to forget. I also want to discuss your speed. Of course, you have the privilege to drive faster than other vehicles, but exceeding the speed limit is dangerous, especially in heavy traffic. Remember, this city has excellent stationing. After deployment, ambulances should be able to reach their destinations quickly without speeding. Also, police escorts are usually available for extra safety. Glenn.
Unit 3, Incident Assessment. Exercise 5, page 9.
Spencer County Health, Patient Care Report. Patient Walker Hawley. Incident number 03-18537. Chief Complaint. The patient was unresponsive when we arrived at the scene. Later, she had complaints about head pain and blurry vision. History. MOI. According to a bystander, the patient was riding a bicycle. Then, she appeared to have a seizure. She fell and struck her head on the sidewalk. NOI. Initially, we got some patient history from the patient's medic alert tag. According to the tag, the patient has epilepsy. This puts her at high risk for seizures. Assessment. The patient was unconscious when we arrived. Contusions on her head indicated blunt trauma. Our general impression was that she sustained a moderate to severe head injury. When she became responsive, she complained of head pain and blurry vision. These symptoms are consistent with an internal head injury. RX. We monitored the patient's vital signs and kept her awake. Transport. We transported the patient to Spencer City Hospital.
Unit 4, Triage. Exercise 5, page 11.
Memo. Hi team, thanks for your hard work after last week's flood. Our team doesn't have much experience with MCIs, but you all remained calm in a stressful situation. Nice job. However, I want to review procedures for triage. If we handle another major incident, we must follow START guidelines. Remember, we tag the casualties for a good reason. Tags are based on basic factors like perfusion and mental status. Some patients need attention right away, while others can wait. Unfortunately, some patients have no palpable heart or respiratory activity. Last week, too many team members wasted time on these non-salvageable patients. Sadly, these patients were already in severe respiratory compromise. They were beyond help. At the same time, Other team members treated the wrong patients first. Remember, immediate patients are the priority. Then you may treat delayed patients and then minor patients. Also, relocate anyone who can move safely. This way, they do not interfere with other emergency procedures. Let me know if you need clarification on the procedures. Thanks again for your hard work. Kim.
Unit 5, Airway Management, Exercise 5, page 13.
Spencer County Health, Patient Care Report. Patient, Sean Baker. Incident number, 51-04832. Chief complaint. The patient was unable to breathe normally. History. The patient's ventilation became compromised during a meal at a restaurant. According to bystanders, he suddenly gasped and grabbed his throat. One bystander tried to perform CPR. However, this treatment was not appropriate for the patient's condition. Assessment. When we arrived, the patient's breathing was very weak. Initially, we suspected aspiration of food. We examined the patient for signs of foreign body airway obstruction. However, no objects were present in the airway. We also checked for laryngeal spasm and a fractured larynx, but the larynx itself was open and intact. Ultimately, we identified a laryngeal edema. Most likely, a food allergy caused the tissue to swell. RX. We administered an anti-inflammatory medication. The patient's respiratory rate and regularity improved, but breathing still required great effort. So we started supplemental oxygen therapy and monitored his ventilation. Soon, he was receiving adequate oxygen and releasing a normal amount of carbon dioxide. Transport. We transported the patient to Flagton City Hospital.
Unit 6, Shock, Exercise 5, page 15.
Peterson's Guide to Paramedicine. Medical emergencies. Shock. Shock is a serious medical condition. It occurs when blood does not circulate adequately throughout the body. Without proper circulation, important bodily functions like hormone production can shut down. Causes. The most common type of shock is hypovolemic shock. It occurs when hemorrhage from trauma disrupts circulation. In other cases, hypoperfusion occurs because of a circulatory condition instead of trauma. Widening blood vessels are one possible cause. The resulting decrease in cardiac output may lead to distributive shock. A less common type is spinal shock, but this type can be very severe. It occurs when spinal trauma disrupts circulation. Treatments. Usually, the most important treatment for any type of shock is fluid replacement. And in many cases, this is enough to restore bodily function. Sometimes, however, it is necessary to prevent further blood loss. A tourniquet is useful for isolating blood loss in one particular limb, and a topical hemostatic agent helps the body seal the wound. See Treatments Shock for more information.
Unit 7, Musculoskeletal Trauma, Exercise 5, page 17.
Franklin Physical Therapy. Injuries. Treatment guidelines for patients. Recovery from an injury depends heavily on proper care. Not every injury requires professional treatment, but some treatment is always a good idea. For sprains and strains, home treatments are typically fine. For one, you must elevate the injured limb to control swelling. Also, apply a cold pack to the affected area. Are you recovering from a dislocation? The same care is recommended. However, you should not attempt home treatment for more serious conditions. A fracture, for instance, requires specialized care. It may be necessary to realign the bone, and only qualified medical personnel should attempt manipulation of a broken bone. Then, your physician will likely splint the area in order to immobilize it. Also, Be sure to follow your physician's instructions carefully. Do you have a leg injury? You will probably receive instructions not to bear any weight. Perhaps it's an arm injury. In that case, always wear your sling or other prescribed devices.
Unit 8, Spinal Trauma. Exercise 5, page 19.
Peterson's Guide to Paramedicine. Injuries. Spinal trauma. Damage to the spinal column causes some of the most potentially severe injuries. Paramedics must treat these injuries with extreme care. Types. The vertebrae and the intervertebral discs are vital to many of the body's movements. Injuries to them can severely limit movement and cause extreme pain. The cervical spine is particularly vulnerable. Damage there can be especially debilitating and painful. However, injuries to the spinal cord are even more serious. It is the path of communication between the brain and the rest of the body. Without it, the body cannot perform its most basic functions. Risks. Paramedics must treat spinal cord lesions very carefully. If a lesion is incomplete, the patient may still recover. However, improper handling can turn an incomplete lesion into a complete one. This is likely to lead to ischemia, sensory loss, and permanent paralysis. The resulting conditions, like paraplegia and quadriplegia, significantly affect a person's quality of life. See Treatments, Spinal Cord Injuries for more information.
Unit 9, Tissue Damage. Exercise 5, page 21.
From Simon Crew, Chief Paramedic, to Ann Solaris, EMS Supervisor. Subject, Update on the fire. Hello, Ann. Here is the summary of Thursday's fire as you requested. An explosion occurred at the Burton Chemical Plant, causing a fire. A large percentage of the workers sustained wounds. Fortunately, however, there were no fatal injuries. Workers nearest to the explosion sustained burns of varying severity. Most sustained minor first-degree burns, while a few sustained second-degree burns. These were mostly thermal burns from the flames. But one worker was very close to the explosion. He had severe third-degree chemical burns on his arms. He was rushed to the hospital for emergency treatment. Elsewhere in the building, workers experienced falling debris. A heavy piece of equipment crushed one worker's hand. This caused a severe avulsion on one finger, which will probably require amputation. Other workers experienced a range of abrasions, lacerations, and incisions. Some are likely serious enough to leave scars, but most are not. Also, a number of workers sustained hematomas and minor contusions. I'll send you a full report in the next couple of days. Simon.
Unit 10, Thoracic and Abdominal Trauma. Exercise 5, page 23. Continuing education for healthcare workers. Trauma to the torso. Increase your knowledge of thoracic and abdominal injuries. The first half of the course addresses the solid organs of the thorax. We'll especially focus on the heart and lungs. For instance, asphyxia is a possible problem when the pleural cavity ruptures. In the case of penetrating trauma, the cavity might fill with air. This is known as pneumothorax. Or blood may fill the cavity instead. This is called hemothorax, and it results from both penetrating and blunt trauma. The course will cover these and other types of respiratory compromise. In the second half, we will move on to the abdomen. Penetrating trauma in this region may damage hollow organs. These organs include the stomach, intestines, bladder, and others. In extreme cases, patients might even experience evisceration. In cases of blunt trauma, a patient may experience acute abdominal pain. This can be a sign of serious internal injuries. This is of particular concern in women experiencing gynecological emergencies. The course will improve your ability to handle these common situations. Unit 11, Head Trauma. Exercise 5, page 25.
Modern EMS. Introduction to Head Trauma. Proper Recognition and Treatment by David Mueller. Paramedics must approach head trauma with special care. That's because head injuries may have a severe impact on a patient's quality of life. For instance, facial injuries can be extremely distressing. The maxillofacial and dental regions include the ears, eyes, nose, and mouth. Damage here can result in loss of the senses. Furthermore, facial trauma may alter a person's appearance permanently. Of course, another major concern is brain injury. The effects of such an injury can be both direct and indirect. Sometimes the most serious symptom is physical pain in the region of the injury. However, there are risks of intellectual and emotional changes as well. That's why brain injuries require quick, accurate assessment. First responders should always assess head trauma patients for signs of concussion. They should also examine the scalp carefully for impact to the skull. This article will address methods for identifying and treating head trauma cases.
Unit 12, Emergencies 1. Exercise 5, page 27. Section 4. Overview of life-threatening conditions. Cardiopulmonary and neurological emergencies. Cardiopulmonary emergencies. Chest pain is a symptom of various cardiopulmonary conditions. For instance, it may indicate restricted blood flow to the heart, called angina pectoris. When a clot causes complete blockage, a patient has a myocardial infarction or heart attack. Without immediate treatment, the patient will go into cardiac arrest and die. After the heart stops, defibrillation is an option. However, the likelihood of success quickly decreases as time passes. Other conditions, such as pulmonary embolisms and ARDS, affect the lungs. These also require prompt treatment. Otherwise, patients will stop breathing, go into cardiac arrest, and die. Neurological emergencies. Neurological conditions are very serious, even if they are not fatal. Many patients do survive strokes and aneurysms, for instance. However, these patients will likely have lasting degenerative symptoms. Serious problems include loss of brain function and impaired motor skills. Some patients even end up in comas. That's why medical professionals must recognize warning signs, like severe headaches and seizures. Unit 13, Emergencies 2. Exercise 5, page 29.
Spencer County Health, Emergency Services Department, Dispatch Log 0105 645 170 Alvarez Street. EMS responded to a call about a 90-year-old male. The patient apparently suffers from dementia. He was exhibiting violent behavioral outbursts brought on by delusions. EMS transported him to Spencer City Psychiatric Services. 0105 927, Kennedy Elementary School. EMS responded to a call about a 10-year-old female. She was experiencing anaphylaxis in response to a peanut allergy. According to her mother, the patient has a history of a weak immune system. EMS transported the patients to Spencer City ER. 0105 1203, the Corner Market. EMS responded to a call about a 53-year-old male. He became lightheaded and collapsed in a grocery store. His medic alert tag indicated that he had diabetes. After administering insulin, paramedics transported the patient to Spencer City ER. 0105 455, 8542 Waterman Road. EMS responded to a call about a pregnant 30-year-old female. She was in labor at her home. Paramedics arrived to find childbirth already in progress. They performed the delivery of a healthy baby girl. After delivery, they transported mother and child to the Spencer City Maternity Center.
Unit 14, Emergencies 3. Exercise 5, page 31.
Health hazards, consuming drugs and dangerous substances. How do dangerous substances enter the body? There are many delivery methods for drugs. Ingestion is common for pills and liquids. Inhalation is another method, which generally acts more quickly. For even faster results, someone might choose injection with a needle. Absorption is a slower method that only works with very strong substances. Methods of exposure. Sometimes exposure to dangerous substances is accidental. For instance, someone might receive a bite or sting from a poisonous animal. In other cases, someone might intentionally poison another person. This might be intended to hurt the person or commit homicide. Most commonly, though, people willingly consume substances like drugs. Alcohol and narcotics are addictive and often lead to drug abuse. Opiates and stimulants are particularly dangerous and are generally easy to get. Hallucinogens typically come with a lower risk of addiction. However, they are still dangerous, as they affect a person's behavior in unpredictable ways. Sometimes people take drugs for another reason, self-harm. Overdose is a common method of suicide. See treatments, overdoses for more information.
Unit 15, Patient Care Reports. Exercise 5, page 33.
From Jack Walker, Supervisor. To Erica Roberts, EMT. Subject: Your reports. Hi, Erica. I'm seeing some consistent problems with your patient care reports. Frequently, relevant information about your cases is incomplete or missing. This is a serious problem. It could lead to improper patient care. I know you are familiar with the chart model. You consistently use it on your reports, and I appreciate that. However, you sometimes forget one section or another. On one recent report, you gave a full history of illness, but then you didn't document the chief complaint. After transport, the doctors didn't know what to treat the patient for. On another report, the assessment did include the patient's vital signs. You must all measurements and observations in detail. On that same report, the RX section was blank. I assume that you did not render any treatment, but if that's true, you must indicate it. Please be more careful on future reports. Your patient's well-being depends on it. Jack.
Book 3, Unit 1, Hazardous Conditions. Exercise 5, page 5.
Is a career as a paramedic right for you? There are many important factors to consider before becoming a paramedic. This job attracts people with a strong desire to help others, and that's great, but candidates must be aware of the risks too. Heavy lifting is one way that EMS workers can become injured. Paramedics are responsible for relocating patients and moving heavy obstructions. To avoid back injury, paramedics must be strong and use proper lifting techniques. Also, paramedics need a high tolerance for noise and confined spaces. Some people become easily distracted or anxious under these conditions. They are not good candidates for the job. And those are not the only hazards. In fact, a paramedic's job can become extremely dangerous. For example, many accidents occur in industrial buildings. Damaged electrical systems lead to a high risk of fire and electrical injury. Accident scenes may be contaminated with dangerous chemicals. These might result in radiation exposure or even injury from explosives. Simply dealing with people can be a challenge too. People behave in unpredictable ways, especially in emergency situations. Many patients are intoxicated or emotionally unstable. This might lead to hostile or even violent behavior. These situations require great care and quick thinking. Yes, EMS is an exciting profession, but potential paramedics must seriously consider the risks.
Unit 2, Hazardous Materials. Exercise 5, page 7.
Biohazard, stay out. Hazardous materials, don't take chances. In hazmat situations, primary contamination is very dangerous. However, it's not the only concern. Secondary contamination occurs when someone accidentally spreads the contamination elsewhere. This can be very serious as it widens the reach of the threat. That's why everyone present must follow procedures. These are the standard hazmat zones. Hot zone. The hot zone is the site of the IDLH contamination. IDLH stands for immediately dangerous to life and health. Corrosive substances, toxic gases, and flammable materials are common here. Moreover, they may be present in lethal doses, LDs. Without proper protective gear, a person may suffer severe injury or death in these areas. That's why only certified hazmat personnel are permitted here. If anyone is unsure about the effects of a substance, he or she should consult the MSDS. If the container is available, he or she may also consult the label. Warm zone. These areas are not as hazardous as hot zones. However, chemical concentrations may still approach or exceed the permissible exposure limit, PEL. Personnel should be especially cautious around pulmonary irritants. Cold zone. All non-hazmat personnel must remain in the cold zone. This area is considered free from contamination. Nonetheless, everyone here should be alert and follow instructions from the hazmat team.
Unit 3, Diseases. Exercise 5, page 9. Peterson's Guide to Paramedicine. Common Diseases. Overview. Exposure to illness is a major part of a paramedic's job. That's why all paramedics must protect themselves against infectious diseases. In the past, many bacterial diseases were commonly fatal. These included conditions like tuberculosis, meningitis, and pneumonia. Today we treat them effectively with antibiotics. However, prompt detection and treatment are important. Otherwise, they can still cause lasting damage and even death. And it's also important to take precautions against more serious bacterial conditions, like MRSA-related illnesses. Unfortunately, MRSA does not respond to many antibiotics, which makes it very dangerous. Viral diseases are another concern. Of course, many are relatively harmless. A generally healthy person will recover easily from the common cold. However, some viral diseases are quite harmful and often incurable. So paramedics are encouraged to get vaccines whenever possible. These are currently available for hepatitis B. However, there is currently no vaccine for hepatitis C. AIDS does not have a vaccine either. Therefore, it's especially important to avoid contact with certain patients' bodily fluids. Some people are at higher risk for becoming HIV positive. See HIV/AIDS risk factors for more information. If you suspect exposure to infected fluids, you should get tested immediately. You should not return to work until you confirm negative test results. Unit 4, Disease Control. Exercise 5, page 11.
Posted October 17th. The Healthy Healthcare Worker. As healthcare workers, we frequently risk exposure to a variety of diseases. Of course, anyone is vulnerable to diseases that are spread person to person. However, healthcare workers are at an especially high risk. This is because they are frequently near infected people. if you work in healthcare, you must take precautions to avoid infection. For one, you must always wear a mask when there is a risk of airborne infection. Also, avoid direct contact with patients unless you are wearing gloves. Often, we have small cuts and abrasions on our hands. If infected bodily fluids come into contact with these areas, you could contract a blood-borne disease. Was your skin exposed to harmful germs? Wash the contaminated area with antiseptic soap immediately. Even with careful habits, infections do sometimes occur. Fortunately, we can eliminate most bacterial infections with antibiotics. Many viral infections, on the other hand, can be more difficult. Sometimes we can treat a disease, but we cannot fully cure it. It's especially important to recognize the risk factors for viral diseases. That way, you can take extra precautions when necessary. Vaccines are available for a number of common infections. Check with your doctor about receiving these important preventative treatments. Remember, you are your most important patient.
Unit 5. Working at Crime Scenes. Exercise 5, page 13.
Crime Scenes and You by Jonathan Stewart, EMT-P. As paramedics, we often respond to calls at crime scenes. These calls require an extra level of care. When you first arrive at a crime scene, approach the area with caution. The assailant may still be in the area, so perform a quick threat assessment and identify routes leading out of the area. That way you can form a strategic escape plan in case of a threat. If anyone does threaten you, remain in a safe place until police arrive. As you perform your job, be aware of your surroundings. Of course, your first responsibility is to treat the patient. However, you should try to preserve the evidence at the scene as well. Fingerprints, blood splatter, and other physical evidence are vital in police investigations. Do your best to avoid disturbing them. Also, you may arrive before police do, so your observations about the scene are valuable. And remember, your patients may be victims of the crime. Pay careful attention to any statements that your patients make. This is especially important if they are losing consciousness or dying. This information can help police identify the assailant. As always, you should provide the best medical care possible, but it's also important to help the police whenever you can.
Unit 6, Advanced Life Support. Exercise 5, page 15.
Lombardo College, EMS Paramedic Certification. Lombardo College provides an excellent education for paramedics and other EMS professionals. Our courses meet all educational standards of ITLS. The Paramedic Certification ALS program is designed for EMTs who already have BLS certification. So, students should already know basic protocols, including procedures for restoring ventilation and circulation. In the program, students will learn more advanced methods for addressing airway issues. These include tracheal intubation and cricothyrotomy. They will become certified in other invasive procedures as well, including needle decompression. The program will also qualify EMS professionals to administer certain diagnostic tests. Students will learn to analyze results from capnography and blood chemistry tests. These tests can reveal essential information about a patient's vital signs and other factors. Furthermore, students will become certified to use a 12-lead and read its results. This system provides useful information about heart function. Additionally, ALS certification allows paramedics to administer intravenous therapy and other treatments. After completing this program, students may pursue additional certification in a particular specialty. ACLS and PHTLS are popular choices as they address common EMS situations. Others choose areas of life support that require extra care and expertise. For instance, some students pursue PALS certification, which qualifies them to treat critical pediatric cases.
Unit 7, Aeromedical Transport. Exercise 5, page 17.
Mount Morris Emergency Services, Rescue Report. Date 12/17. Prepared by G. Peters, EMT. We received a phone call from a hiker in distress. He was lost in the West Mountains and could not find a way out of the wilderness. Furthermore, he had fallen down a steep embankment and believed his ankle was fractured. We prepared for search and rescue immediately. Since the area is rural, we used the aeromedical transport team. Our aircraft was a P-94 Med Evac helicopter. Our crew included the pilot and 3 paramedics with certification for rapid transport. We reached the West Mountain area within 15 minutes after the distress call. However, we did not know the exact location of the hiker, so we circled the area several times. Fortunately, ground-to-air communication contacted us with additional information. Local law enforcement was able to track the location of the hiker's cell phone. We followed the coordinates and found the man. Fortunately, the man was in a fairly clear, flat area, so landing was easy. We brought the patient on board and administered fluids for dehydration. Also, we splinted his injured ankle before takeoff. We completed the airlift without difficulty. Then, we transported the patient to the landing pad at Morris Medical Center. From there, hospital personnel took charge of the patient.
Unit 8, Major Incidents. Exercise 5, page 19. Flagton recovers quickly from earthquake, by Samantha Wells. Mayor Carlson deserves a big thank you from the people of Flagton. Her response to the recent natural disaster was rapid and well organized. Consequently, this major incident had a minimal effect on residents. The earthquake struck early Wednesday morning. Falling debris blocked roads, affecting transportation throughout the region. The damage also disrupted technical systems, like phone and internet connections. But Flagton was prepared. Mayor Carlson immediately deployed resources to clear the roads. This ensured passage for emergency vehicles. She also activated an emergency radio system so personnel could communicate. Furthermore, the mayor relied on extensive intelligence sharing and interagency cooperation. EMS workers from other jurisdictions joined the search for injured residents. And with Mayor Carlson in charge, these challenging operations were smooth and efficient. Other municipalities could learn something from Mayor Carlson. For instance, the nearby city of Galindo mishandled a major incident last year. In July, a massive fire destroyed much of the downtown area. First, there were disagreements about who was in command. Also, there were no established procedures, and emergency resources were scarce. Mass confusion and rumors about terrorist activities caused widespread panic. This led to civil disorder, and even a riot outside City Hall. Clearly, the city of Galindo would have benefited from Mayor Carlson's capable approach. Unit 9, Pharmacology 1, Exercise 5, page 21.
For immediate release, Garner Pharmaceuticals introduces new products. Garner Pharmaceuticals is releasing 3 medications this month. Trade name, Panasil. Panasil is Garner's latest analgesic. This drug is intended to reduce post-surgical pain significantly. The non-drowsy Panasil daytime formula causes minimal impairment of the patient's mental state and motor skills. This makes it preferable over many other analgesics. Alternatively, the Panasil nighttime formula is approved for use as a sedative. Panasil is available by prescription only. Trade name, Tropro. Tropro was recently approved to treat several mood disorders. This psychotropic enhances a patient's mood. However, it does not have the dangerous side effects of earlier products. Patients generally experience improved motivation and reduced anxiety. Tropro is available by prescription only. Trade name, Adazone. Garner released prescription-only Adazone 5 years ago. Since then, it has become a very popular hypnotic. As a sleep aid, This drug has proved to be effective and quite safe. As a result, the National Administration of Medicine recently downgraded its classification as a controlled substance. That means that patients can purchase it without a prescription. Atazone still contains the same formula, but is now available over the counter. Please visit Garner's website for the generic names and chemical names of these products.
Unit 10, Pharmacology 2, Exercise 5, page 23.
Pharmacology Monthly. Letters to the editor. Dear editor, I was dismayed by last month's article, Sennifer, the Magic Analgesic. The article strongly endorsed the use of Sennifer to relieve pain. However, the author failed to discuss the serious risks that accompany this drug. Hospitals often use Sennifer largely because it is inexpensive. Additionally, the loading dose is fairly small in comparison with other analgesics. However, I believe that the risks significantly outweigh the benefits. For one, the therapeutic range is small as well. It's actually quite easy to administer a dangerously high dose. Furthermore, the duration of action is very brief. Let's also consider the high rate of adverse reactions among Sennifer users. Side effects include rash, fatigue, abdominal discomfort, depression, and confusion. Users are likely to experience additional side effects if they take other medications. That's because Sennifer has a long list of unpleasant drug interactions. And that's not even the worst part. Sennifer is also one of the most addictive pharmaceuticals on the market. Patients quickly develop a tolerance, and then they need more and more of the drug. The withdrawal is particularly severe and may include psychosis. Consequently, supposedly short-term usage can lead to drug abuse and overdose. I urge your publication to offer more balanced coverage on this drug. Sincerely, Ryan Hinton.
Unit 11, The Health of a Paramedic. Exercise 5, page 25.
The first responder. Advice. Ask Dr. Dan.
Dear Dr. Dan, I am a paramedic in a busy EMS department. Lately, I've been experiencing an unusual amount of fatigue. I'm not overweight, and I don't drink alcohol or smoke. What should I do? Michelle from Lakeside.
Dear Michelle, fatigue can be a serious problem, especially in a high-stress job like yours. I'm glad to hear that you don't drink or smoke, but you might need to improve your overall fitness. Adequate exercise is important in your job. You must be able to move quickly and precisely. Core strengthening helps you to do that for long periods. Also, you must often lift patients. Good resistance training and proper lifting techniques will make this easier. Additionally, nutrition matters. You mentioned that you're not overweight, so you don't eat too much food. However, you might eat the wrong foods. There are many websites, books, and other resources for tracking nutritional intake. Find a system that works for you. However, these are just general guidelines. If your problem is serious, you should see a doctor. Your fatigue might be caused by a medical condition. Get a thorough checkup to find out, and ensure that you have current immunizations. In general, pay close attention to your mental and physical well-being. Your patients depend on you. Dr. Dan.
Unit 12, Managing Stress. Exercise 5, page 27.
EMS resources. Dealing with stress. Paramedics perform a difficult job. Most feel overwhelmed at some time or another. Fortunately, there are many resources to help paramedics manage stress. I'm suffering from burnout. Adequate time off can help you avoid burnout. Talk to your supervisor about a good time to schedule a vacation. I'm feeling a lot of anxiety about my job. I can't stop thinking about work, even when I'm at home. Recovery from stress and anxiety can be very challenging, but guess what? You don't have to do it alone. Ask your supervisor about your department's resources for counseling. There might even be a program for family support. This is especially useful if your job is interfering with your relationships at home. Your spouse may benefit from learning about your job and ways to recognize stress. If he or she notices warning signs, it might be time to schedule a follow-up session with your counselor. Take control of your emotional state. I'm feeling a lot of distress over a particular recent call. Critical incident stress can occur after an especially tragic situation. But remember, you're not the only one to feel this way. Try attending a local peer support group. You'll meet other people with similar experiences.
Unit 13. Dealing with Death. Exercise 5, page 29. The First Responder. Losing a Patient, a Paramedic's Challenges and Responsibilities. By Kelly Watson, EMTP. Every day, paramedics save many lives. However, all paramedics encounter some patients that they cannot save. Dealing with death is a challenging part of the job. As a paramedic, you will naturally do everything you can to save a patient. But a moment may come when you realize that it is too late. At this point, it may become your job to comfort the dying patient. Make the patient as calm as possible, but be honest about his or her condition. And remember, religious beliefs often affect a person's experience of dying. Make sure to respect your patient's spiritual needs. When the patient passes away, your job isn't done yet. You may need to help the patient's family through the initial shock. Use a calm, quiet tone of voice. It's important to be empathetic and acknowledge the sad loss. However, many families want privacy. Assure them that you are available, but then let them grieve privately. Finally, paramedics must maintain an emotional distance. It's okay to feel sad about losing a patient. However, some paramedics experience overwhelming guilt about patients' deaths. They have feelings of personal failure. Remember, some patients are simply beyond your help, but many others do need you. Don't let guilt stop you from doing your job. Unit 14. Ethics. Exercise 5, page 31.
Spencer County Health, Department of Emergency Medical Services. Section 2. Responsibilities. As a healthcare professional, one of your obligations is to save lives. However, you are also responsible for respecting patients' rights and wishes. What happens when these two responsibilities conflict with each other? In general, follow legal guidelines first. Are you performing an invasive procedure? Get informed consent from the patient first. Of course, this is impossible if the patient is non-responsive. In this case, get consent from the family or follow guidelines of implied consent. As a general rule, do whatever is in the patient's best interest. That usually involves life-saving treatments. However, you will encounter some tricky situations. For instance, a life-saving measure might seem futile for a particular patient. Nonetheless, you must attempt it. On the other hand, another patient might have a DNR. You might feel that your moral duty is to resuscitate the patient, but in fact, your ethical obligation is to respect the patient's wishes. Other patient rights issues, like confidentiality, can also be challenging. Sometimes, patients decline to share information with their families. But what if the patient's condition affects or even endangers family members? Be sure you know the current privacy laws and practices in your jurisdiction. Otherwise, you could face a lawsuit. In the next section, we will cover specific legal requirements in Spencer County.
Unit 15. Certification and Careers. Exercise 5, page 33.
Elizabeth Watson, 581 Baker Street, Lakeside. Dear Mr. James, I am very interested in your open position for an EMS supervisor. My background and education provide me with a strong set of skills. As an adolescent, I was a volunteer with Flagton EMS. I assisted the ambulance crew and sometimes the dispatcher as well. I completed on-the-job training as an EMT and earned BLS certification that way. I continued working for Flagton EMS as I pursued ALS certification. When I got licensure as a paramedic, I took a job with Spencer County EMS. There, I had the privilege of working with physicians and specialists in various areas. This was excellent experience. Earlier this year, I earned an associate's degree in EMS management. This qualifies me to be a supervisor or team leader. I'm confident I can lead an EMS crew effectively and efficiently. I believe a team would benefit from my experience and education. You may notice that my ALS certification is from another jurisdiction. However, I already ensured that my certification has reciprocity here in Lakeside. Also, the results of my most recent physical are enclosed here. I will happily agree to a background check, drug screening, or any other pre-employment requirements. Thanks for your consideration. Sincerely, Elizabeth Watson.
AVN Pharma Education.